While we have you sitting up, we're just gonna be checking your cerebellar function. So we're gonna do two tests for this. Can I have you, so this test,
Just a
I'm
physical.
just looking at the camera, you can feel here.
Nope, I'll do
And then this is
more
gonna be
questions.
moving,
Do you know where
just
you are?
touching that.
Gallagher Hall,
So,
perfect. And then do you know what month it is? November. Perfect. So patient is oriented to place, person, time, and situation. Times 4.
Perfect.
All good.
And then we'll have you lay down.
So now I'm going to ask you a few questions.
So this test is gonna
before
be
the I'm gonna get some
the
vitals.
heel-to-heel test.
I'm
So
gonna get
can
your
I
blood
have this
pressure,
heel come up to
pulse
your knee?
rate, and respiratory rate.
And then from there,
Does
you'll
blood
just
pressure run
be
higher
dragging it
family
down.
Nope. Nope. All good.
And then one more
So I
on
might
the
have
other
you
side.
remove that shirt. Can you roll it up all the way? Yep. Roll it
Okay,
up. See if you
perfect.
can roll it up.
So the cerebellar function
Oh, that
is
should be good. That should
present,
be good.
everything seems to be healthy.
Take that real quick.
That's all I have for you today.
this
My
up
findings,
there.
everything looks good. I would say if there wasn't
Are you,
something I could
allergic to
educate you
anything?
about,
Nope.
it's just
Nope,
when
all
going outside, make sure you're trying to
This one.
transfer the best of your ability. I know it's hard, I can't say I do it either, but, definitely something, skin cancer is one of the biggest causes of cancer in the United States. Do you have any questions for me before I go?
Alcohol, wait.
Perfect, so that's all
Alright,
for
this
me.
might be a little cold.
I'll
Let me
provide
just
you
breathe normally for me.
with
I'm just gonna be
the
listening to your blood pressure.
Oh, that was so good.
That was so
Good
good.
job.
26.
Nice.
26 minutes.
Nice,
Not
thank
bad.
you.
Yeah.
Yeah, the only nerve that you missed was the gyre reflex. That's the only
Oh,
thing,
okay.
that's the only thing I missed. Still not the thing I missed, yeah.
I have 2 things, but I don't want to make you feel bad.
No, it's good. I
Okay,
gotta hear that.
dorsalis pedis pulse is 1+, not 2+.
Okay.
And then also make sure you check anterior tibial pulse and popliteal pulses.
Okay.
And you gotta check for brachial pulses too. You
Blood
usually do it
pressure
all
was
at once, so it doesn't
120
matter.
I didn't know
over
if they
80
did
on
it
the
for
dot,
the
which is
CBD.
both shocking and
Yeah.
completely normal.
And also,
Which is obviously a good thing.
trust
If that
the
starts to
back.
rise
Other
because
than
of
that,
my
you
age,
learn to do
then you let me know.
Oh, yeah, I did forget your
And you can go that.
Oh,
One of those
Taurus
days.
syndrome.
So I'm gonna take your pulse rate real quick. Just for 30 seconds, you relax your arm.
Thank you so much. I appreciate it.
Oh my gosh, yeah, of course, man. No. Of course. Okay, I gotta go check this.
Pulse rate was 68. Sorry. Check it one more time just to be sure.
I guess that's checked with swallowing and, yeah, that is.
Perfect. And respiration rate was 14, which is completely normal. Now we move on to assessment of the head and face. Do you have any like bumps or lesions in your skull that you know of?
Nope.
Any oiliness or dryness in your hair?
Nope.
Do you wash your hair frequently?
Yep.
Okay. What do you use?
Just shampoo.
Shampoo, conditioner. Okay. Any gels or anything?
No.
Okay. Do you have any sinus pain that you know of?
Nope.
Okay. Note that face is evenly distributed with the skin. Hair is also evenly distributed. The face is symmetrical bilaterally, which is good. So now I'm just gonna palpate your skull, palpate your sinuses. Let me know if there's any pain. So here. No pain. Palpate the sinuses. Again, let me know if there's any pain. Any pain?
Nope.
All good. So now I'm just gonna look at your ears and eyes real quick, see if there's anything wrong with it. Look. Note some earwax and no excessive swelling or bruising or edema of either ear, which is really good. Can you pull down on your conjunctiva? Perfect. Sclera is white and moist, which is pretty normal. There's no swelling, no bad excessive redness, which is good. Do you see a eye doctor frequently?
Nope.
Nope. Not once a year for physical?
Just a month.
Oh, just annually then?
Yeah.
Okay. Recommended like twice annually. Do you have any vision loss or use contacts?
Nope.
Nope. All good. Do you have any history of glaucoma or cataracts?
Nope.
All good. So do you have any history of hearing loss then?
Nope.
Perfect. Well, then we'll just get right into it. Let's start by looking at your ear. I'm gonna lift up on that pen. Put a flashlight in. I note there's earwax present, which is normal, and the tympanic membrane is shiny and gray. On the other side, do the exact same thing. Lift up gently, and see tympanic membrane shiny and gray. Earwax present. So now I'm going to assess your eyes. You're going to look past me, not directly in the light. Okay. So here, go, and then back up. Perfect. Same thing on this side. Perfect, and then you're just gonna follow this in. Perfect, and then you're just gonna follow my finger. Okay. Sorry, I've noticed your eyes are watering. Did I shine too much in?
I think I just looked at it a little bit.
Oh,
Not on you.
Oh, good. Sorry about that. Anyway, so follow my finger. 1, 2, 5, and last 6. And then I'm gonna have you read this real quick. What's that letter say?
P.
And this number?
1.
And then this word.
Advanced.
Perfect. Cranial nerve 3, 4, and 6 all intact, which is parallel. Pupils equal reactive to light and round and accommodating, which is good and normal. So now I'm just gonna palpate your TMJ and some of your lymph nodes, see if there's anything wrong with that. So if you feel any pain, so first open your mouth and clench it. Perfect. Palpate the lymph nodes underneath. All good. All good. Here, all good. Go back here, all good. 1 here, 1 here. Nothing there. I'm gonna note skin turgor here, so I'm gonna pull this down and pinch your skin. Perfect. Skin turgor is less than 3 seconds, which means there's no tenting, and you're hydrated, which is a good thing. Sorry. Now I'm going to have you open your mouth so I can look at that. Open your mouth. Say Good. I see tonsils are noted. Midline. So is the uvula. Can I have you look at move your tongue to the hard and soft palate, so the top, roof, and bottom of your mouth? Good and good. How often do you see a dentist?
Once a year.
Once a year? Okay. And how often do you brush your teeth?
Twice a day.
And floss?
Once a day.
Perfect. Do you know any bleeding of the gums, bruising, pain? Nope. All good. Perfect. Recommend seeing a dentist like twice-ish a year, but once is fine. Better than most people, of course. So now I'm gonna have you rotate. Let your legs hang off the bed. I'll lift that back up for you. Pull the chest real quick, and I have you look side to side, up and down. Raise your shoulders. Perfect. So now I'm gonna do against resistance. So turn your head my way. Perfect. This way, and then raise your shoulders. Perfect. So cranial nerve 11, spinal accessory nerve is intact. And now I'm going to conduct the whisper test. So I'm going to go behind you. You're just going to repeat back to what I say. Got it? Right.
Cow. Cat. Dog. Parrot.
Chicken.
Chicken.
Perfect. Parrot throws in. Gets a little confusing. It's doing pets, you know. So the whisper test is positive. That's vestibulocochlear nerve, which is cranial nerve 8, intact. Now I'm going to assess for the carotid pulse and jugular vein distension real quick, so you can just chill there and do what you're doing. Good, no jugular vein distension, no jugular vein distension. Feel right here. Feel right here. And then can I have you swallow for me? On this side, one more time. Perfect, so I note tracheal midline, swallowing is normal, which is the glossopharyngeal nerve, cranial nerve 9. It was intact, or when you move your tongue, that's the vagus nerve, cranial nerve 10 was intact, completely normal. So now I'm going to have you actually do nothing, sorry. I'm going to ask you some questions about your respiratory system. Do you have any difficulty breathing?
Nope.
Nope. Any, like, short breath, asthma, or anything? Do you take any of that?
No,
all good. Does any of your family have any of that? Nope, all good. Well, then I'm going to have you remove your shirt so we can assess your chest. Just pick up your side here. Perfect, so I'm going to start by assessing this, the front chest. Notice skin is evenly distributed, hair is also evenly distributed. Note some moles, there's normal. The mole, okay. If those get bigger, let us know. That could be indicative of anything. eyes. Skin color is a little bit lighter on the chest, which is normal relative to the arms. Do you wear sunscreen at all?
Yep.
How often?
Just during times of high sun.
Yeah, okay. as expected. So UV light is the number one cause of skin cancer. So it's recommended you wear sunscreen every single day. So that's just the only recommendation I have. But right now, chest looks good. I'm gonna look at your back. Looking at the back. Back looks completely normal. Spine is midline. Now you move this arm just a little bit forward. Perfect. Yeah, evenness of all that. So now I'm going to perform a couple tests. This is called the tactile fermentis test. Just repeat 99 after for me.
99.
One more time.
99.
One more time.
99.
And one more time.
99.
Perfect. So I'll take one deep breath. Perfect. Chest expansion and tactile fermentis, both normal, so vibrations occur throughout the back. So now I'm going to actually percuss your back. So I'm going to hit my fingers on your back. So we'll go one here. We'll go one there. One there. There. Last two. Perfect. Percussion, so no abnormal sounds, no dullness. There's no respiratory so I'm just gonna listen now. It's just be a bunch of deep breaths, so if you lose any of your breath, take a little breather. Right?
Yeah, sometimes it'll get a little higher. Sounds good. Alright, I'm gonna go ahead and put this on your same arm, okay? And if this is any
Perfect. Over here.
That's okay for you.
No, that's perfect.
Alright, just wanna make sure. Here, my stethoscope too. Okay. Go ahead and uncross those feet for me, please. Thank you.
Oh.
Alright, so give me 10 up on here. Okay.
A little note under here. Two more on this side. If I can have you lift your arm just a little bit. One more. Thank you. And then three more over here. Last one.
Alright, so you got one foot forward, over.
Appreciate it. Was there any pain with that?
Nope.
Nope. Alright, all good. Sounds normal. Sorry about that. I'm just moving it for you. On the trash can there. Same thing in the back. So if there's any pain or you catch your breath, let me know. So I'll start here.
If there's any pain over the course of what we do, just let me know, okay? Okay. Alright, so with that done, let's start by looking at your head and neck region, okay? Okay. I'm gonna go ahead and look at your face, inspect it. I see that there's no visible vascular lesions. I see a little bit of acne. Is that common for this time of year?
Yeah, that's really don't do anything about it, just kind of
Let it go.
shower and see.
Gotcha. Do you notice any abnormal face drying during the winter?
No,
Gotcha. And then you usually moisturize it all besides that.
no.
Gotcha. Sounds good. Just make sure to stay up on that. It'll help along.
Okay.
Go ahead and take a look at your family flow around for anything that can't.
Perfect.
See, okay?
Lung sounds all sound good.
So here-
I do know a little bit of arching in the back. Is that normal for you?
Yeah.
Okay. Does that cause any pain breathing, any difficulties?
No.
All good. Alright, well then I'm gonna have you lay down if you can keep the gown and shirt off. I'm gonna ask you some questions about your cardiac system. Do you have any history of like hypertension?
Nope.
Any sudden chest pain? Any, I guess blood clots or anything? Nope. Anything in your family like that? Perfect. Then we'll just jump right into it. So I'm gonna just listen to the heart sounds. I'll let you know what the areas I'm listening to are. So this is the aortic sound.
And then
You
you
can
go
just
ahead
breathe
and stop
normally.
me. And then frown. And last, you pull up your
Present.
face.
We'll go over here.
And blow it out. Perfect. That's facial nerve. Your facial nerve is intact. We'll go ahead and move on to
That
your
was
eyes,
the
okay?
pulmonic. This is
Alright, so what I'm
Herb's
gonna
point.
start Here is a very bright light. I already apologize in
Okay.
advance. We'll go ahead and shine this in your
Perfect.
eye.
This is
Straight
tricuspid.
over my shoulder for me, okay?
And this is apical, which I do have to take for a minute. So doesn't mean anything is wrong. I just have to measure.
Alright, your eyes are round. We're gonna see the light and accommodate, so what we call perla, and that's what to see as well. And that tests for your oculomotor nerve, which is awesome. And next what we're gonna do is we're gonna go ahead and do a reading test. I have a couple words wrote down right here. Go on, just read them out to me, okay?
Okay.
Or number, just say. What's this one for you?
118 over 64, 12, and 66.
Perfect. Pocket nerve is intact. Next what we're gonna do is we're gonna go ahead and before I forget too, can you go ahead and slightly pull down your eyes? conjunctiva and sclera is appropriate for color. Alright, nice, thank you very much. And I'm gonna move on to your ears. Do you ever realize that, or have people ever told you that you're hard of hearing?
No.
And do you have any, like, ringing in your ears as well?
No.
Alright, I'm gonna go ahead and pop it around. If there's any tenderness or pain, just let me know, okay? Is there any pain on moving like this?
No.
Perfect. Alright, and then now. Alright, so what I have you do is I have this outside.
So apical pulse was 78, which is completely normal. Anything less than 100 and greater than like 60 is within normal limits, so it's good. I can have you put your gown or shirt back on.
Yeah, perfect. That is in fact, go ahead and see from.
And then now I'm going to assess your stomach. So
There we
do you
go.
have any history of like abdominal surgery done? All good.
So do you ever have a vagina and mouth around the
And then, when was the last time you passed school? Yesterday. Do you have any difficulty passing school? So how did you describe it? Just normal? Perfect. So I'll just lift your shirt up a little bit, give a little inspection. Just gonna make sure it's sorry, make sure it doesn't fall down. Inspecting. There is no abnormal rounding or ascites of the stomach, which is good. Umbilicus is no midline. Hair is evenly distributed, and the skin is normal for ethnicity, which is completely normal. So now I'm going to auscultate because if I percuss or palpate next, it'll skew the abdominal sounds.
Well, try to think
So I'm
about
just going to
that.
listen here.
And then, let's see here. Next, I'm gonna go ahead and go into your neck region, okay? Well, I'm also gonna check for JV
Good.
and a lot of different things. Just bear with me. Alright, so you can go ahead and
Good.
Alright, and then we'll go.
Good. Last one.
Alright.
Good. Lung sounds present in all four quadrants, which is completely normal. I'm going to just now percuss, so it means the same tactic I did on the back, so I'm going to hit my fingers. Good. 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 Perfect. No abnormal sounds or dullness coming from that area. That's good. So I'm just going to palpate now. So gently feel here. Tell me if there's any pain. Nope. All good. Perfect. So I can lower this here. So now I'm going to have you roll up your sleeves if you can. Perfect. Perfect. I know it's a scar there. Is that from anything?
From an ACL
Okay.
reconstruction.
How long ago was that?
A year and a half ago.
Perfect. Does that cause you any pain or anything now?
Nope.
All good? Alright, so then I'm just going to start by, I can have you roll your sleeves up too. I'm going to feel temperature on both upper and lower extremities. I note that hair is evenly distributed across, skin is also evenly distributed. I note the scar, which was from the ACL surgery, which doesn't cause any pain now, but obviously it's a scar. So feel here. Temperature normal bilaterally. Same thing with the upper arms. Feel a little bit under if I can.
Vibrations with all throughout, just let me see.
Good. Temperature is normal for all four extremities, which is completely normal. So now I'm going to remove your stomach and feel your dorsal palace pulse. And if it's comfortable with you, I'm going to have these removed for the rest of the assessment. Perfect. So I'm just going to feel. Pulse present. And then pulse also present. So +2 bilaterally for the dorsal palace pulse, which is completely normal. Sorry. And then now can I have you rotate off the bed? We'll do some motion assessments. So besides the ACL surgery, have you had any other like muscle or bone issues?
Nope.
Breaks or anything? Nope, all good. And you don't have any pain walking or anything like that? Perfect. So we'll just get into it. So have you lift your leg up for me. I'll take this off real quick, actually. I'm gonna have you point your foot towards me, and towards you, and this way, and this way. Perfect. And then resistance. So just push and push back, and this way, and this way. Perfect. Same thing on this foot. So towards me, towards you, this way, and this way. Same thing. Push, 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 push. Perfect. So there's full range of motion against resistance in both feet, which is good. So now I'm gonna have you. You can roll your sleeves back down if you'd like. We're gonna do some range of motion stuff. So if you want to take the paper gown off, I might get in the way. So I'm just gonna have you do walk towards me first, and then walk back on your toes, and then walk back towards me on your heels, and last but not least, can I have you walk on your heels? Oh, we're not walking your heels, sorry. Walk tandem steps, sorry. Heel after the other, my bad. All over the place today. Alright, so range of motion, smooth gaze, normal, all good. I'm gonna have you step a little before, so you'll kick your mannequin. Kick your leg forward and back. Forward and back, same thing. On the other leg. Perfect. With the same thing as resistance. So kick forward. Good. And back. Good. Forward. And back. Good. And then I'm gonna have you come across like this. Cross again. And the same thing, resistance, so come towards me. Out. In. And out. Good. And then just flex the knee. So just like this. For both knees, and extend. Yep. That knee. Perfect. I'll slide behind you here. Kick back. Kick forward now. Perfect. Here, kick back and leave it there for a sec. Good. And go. Perfect. So there's full range of motion in both legs, which is completely normal. So now we do arms. So lift up and down. Inside and down. And then across. And across. Good. And then I'll flex like a bicep curl. Yep. Perfect. Extend it. Perfect. And then do like this. Perfect. So now we'll do the same thing, just resistance. So we'll go, you're gonna go up first. Ready? Perfect. And back down. Good. Now sides. Good. Down. And come across. We'll go this way first. Perfect. We go out. Sorry. There we go. Now in and out. Perfect. Now flex in. Good. Back down. Good. And then you're gonna grab my wrists. So we'll go like this. You grab my wrist and rotate it in and out with resistance. In and out with resistance. Perfect. So there's full range of motion in both upper and lower extremities. Have you stick your fingers out like this. We'll assess calf refill real quick. Calf refill is present both in both fingers bilaterally, less than 3 seconds, which is completely normal. Have you sit down. A few more tests real quick. So we're gonna calf refill the toes real quick. So just take them out. I'll just grab here. Exact same thing. Minus 3 seconds bilaterally. And then last test real quick, I'm gonna have you smile, be sad, angry. Perfect. Put your hands sanitizer so you don't get toe gunk on you. Be angry one more time, and then resistance. Perfect, and then puppy cheeks. Perfect. Cranial nerve 7 is all intact. Last test I'm gonna have you do, last 2 tests. Finger to finger, finger it is. So I'm gonna hold my finger here, you go nose to my finger, and I'm gonna move it around, okay?
I'm gonna have you do is I'm gonna have you hold your arm straight out for me like this.
Last one. Perfect. And then the other hand.
Thank you. Go ahead and
perfect.
down real quick. Thank you. Two hands down.
Perfect. And last test I have you do is lay down for me. And stick your legs out. I'm just down for you. Sorry about that. And then I'm gonna have you drag this heel across that shin like this. Perfect. Same thing on the other foot. Perfect. All right. So movement of both those are smooth floating. I mean, the function is intact. Everything's good. Cap refill was normal. Skin temperature was normal. Only thing we noted was sunscreen. We should wear every day if you can. If not, understandable, but it's highly recommended. Back was a little curved, but you said it doesn't cause any issues. If that does start to cause issues, let somebody know. Hair was normal. Face was evenly distributed. Skin is normal, symmetrical. Lymph nodes not detected. Eyes, pearl was intact. Facial nerves are all intact. Your hearing is good. Full range of motion in the neck with resistance, and stomach sounds all good. So, do you have any questions before we go? Perfect. Well, I'll be in shortly to help you out.
Thank you.
Thank you.
I was gonna say like soft.